Gentlemen, start your engines. Hey everybody, it's Dr. Joe at Camden Medical. Thanks for tuning in. Today we're talking about men's vitality. I hear a couple things a lot in my clinic. I hear men talk about how they are on medicine but they don't want to be on medication, how their energy level is low. And I talk to wives who worry about their husband, who bring their work home, who are agitated and burned out. Now the common parlance is your T is low. Maybe it is. There's something called functional hypogonadism where if you're not healthy, your T is lower than it really is. And if you get healthy, your T goes up. Your T meaning testosterone, of course. So if you go to a men's clinic, it costs $3,000 a year to get testosterone. After a couple of years, your body will become dependent on testosterone and you'll never be able to make your own. So you'll be on testosterone forever. Start testosterone when you're 50 and you do the math, $3,000 a year. By 60, you've paid $30,000, and by 80, you have paid $90,000 at today's prices. Or you can come see me and learn how to take care of yourself, and maybe you'll never need testosterone. You maintain your freedom, your independence, and your autonomy. So, in order to boost your testosterone naturally, you need to take care of your blood vessels. So that's eating a plant-strong diet and avoiding saturated fat. So I do that a lot. That's why my mascot is actually the candy carrot. All right, now, I used to lift weights a lot, and one way to boost your testosterone other than taking care of your blood vessels is to do resistance training and lift weights. Now, people that want to put on lean body mass, there are lots of guidelines in the literature about how to do that. So to put on lean body mass requires that you eat healthy. It requires that you take adequate protein. And so I actually do take a workout stack, which I also would consider my men's vitality stack. So when I work out, I take a stack equal to what other people take. I take a nitric oxide booster, which improves blood flow to the muscles, and it may do other things. We'll talk about that later. So I take an Upbeat from Neolife, which is a natural nitric oxide booster. I also take protein powder when I work out. So I take a Neolife protein shake, and they just came out with a performance protein powder, which I'm also going to switch to because I think it'll be easier at home. And if I need caffeine, I take caffeine and Elevate, which is green tea caffeine, because green tea is good for you and it doesn't make you super shaky. But the key part is the resistance training. The resistance training spikes your growth hormone, which makes you produce testosterone. Okay, now for some people, these interventions do increase their testosterone, but it doesn't fix burnout, doesn't fix engagement, it doesn't give them joy and purpose. So that's why when people come to see me, I start with the lifestyle medicine for some people, but for other people, I start with coaching, or you can put them together. So here's what I think. I think if you're a man and you're trying to be more vital, you're trying to have a life of purpose and meaning, you're trying to take care of yourself so you do great at your job, but you also want to be true to yourself so you can take care of your family and have friends and I'll take care of your community, then you should come see me for a lifestyle medicine consult. And consider adding coaching package to it. If you do that, you do both together, it's going to be a 3-month journey. You're going to do the 2 visits for lifestyle medicine. You can do 3 months of coaching basically. And this is a commitment to yourself, and summer's a great time to start. So wives, you get your husband to sign up today. You get that guy to sign up and you get him here. Or husbands, you make that commitment to take care of yourself and your family and you sign up. I'll see you soon. I love to take care of you. Confidential, professional, evidence-based. I'm here for you. I'll see you later.